short time, half an hour, but we're gonna have fun. Chewing. So much thing to say. We all got a story. And I tell you, friends, no man is an island. You need friends. And always find someone, real friend, that you can sit down and talk to. Because sometimes you may go through some things and you want to keep it to yourself. And it may be something that can be helped. Remember, people who've got mental problems or mental illnesses, you want to say, they think that they're okay. It's the other people think that something is wrong. You do something that is against society or the culture, yes, it's considered inappropriate, antisocial, and for that specific culture, you may be considered as someone having a mental illness. And it doesn't have to be the severity of, like, the vagrants in the street. No. It could be something that you can live with. A lot of people go into the psychiatric hospital there in Black Rock, and they come back out after treatment, and they walk on the street, you wouldn't know they had a problem or have a problem. Listen, all you need is a little bit of something, a little stressor to push them over the edge. You walking down the road and you step in someone's shoe. Yeah, turn around, tell them you're sorry. Then you're sorry about that, and what can I do to help you? No, you don't know who that person is. Remember, all that glitter is not gold. So, let's talk about some of the things that you experience, like depression. Depression is one of the mental illnesses that it is major, and there's all type of atypical depression and so forth. But I'm going to go over some of the signs and symptoms that you experience, and tell me, think about them. If you're experiencing these things, it may be good to consult someone and talk to someone, difficulty concentrating, remembering details, and making decisions may be a sign. Feel extremely fatigued, and your energy is like seeping out of you. Feelings of guilt, worthlessness, and helplessness, actually. Feelings of hopelessness and pessimism, or you're feeling like everything is negative. Can't sleep. Lay down, you're looking at the roof. You can't sleep. Or excessive sleeping. All these could be signs of depression. Irritability, restlessness, loss of appetite, and you found that you once loved playing football or cricket, and then you have no interest anymore. Something happened. You've been playing this from boyhood days, so you know something happened, and appetite loss, and or overeating, actually. And then you find sometimes you're empty, sad. Why am I sad? There's no reason. You wake up in the morning and you're crying. Why are you crying? You saw a fly on top of your counter or on top of your refrigerator, and you sit down and start to cry. That's not normal. So these are some of the signs as we go on to other things, You're talking about death a lot. You're talking about suicide a lot, and you're talking about how it'll be nice to beat the red light and see what's it like, and those type of things, So, you as the family member, you see your loved one or your friend change in these forms, suddenly want to go and change their wills drastically, change their will for whatever reason, things like that. You know that there may be something going on. And those are some of the signs of depression. And I said a lot of people are depressed in this world today. There's also anxiety. Well, this one is really would get you, because anxiety has so many symptoms. That fear, the phobia that you get. You get up in the morning, and for some reason, you just start to feel like if you're gonna die, and your heart is racing, and feel like impending doom, and so forth. And it can't stop. It wouldn't stop. Signs of anxiety problems. You could have sometimes it expresses itself in the body, where you feel like ant is crawling on your skin all the time, chest pain. You feel that you're unnecessarily getting a lot of illnesses and small flus, and you never, a person like that, hair loss, neck, shoulder pain, and all these things, numbness about your body. We talked about a lot of chest discomfort, concerned about your heart and so forth. Fear of losing control. Fear of things that normally people are not fearful of. Simple things. Dizziness, numbness, entire body. So you find that your body change and all of these things start to happen. Something is going on. You cannot go and perform your work. You worry that if you go in there, you're going to make a mistake. And you're paranoid about the whole thing. You have had people who would not even go into certain rooms because they're scared that somebody's going to get them. How about the ones who would come by and would not go into a room with a cell phone because they feel that people are monitoring them? All these things happen to people. And as a matter of fact, they think it's normal. So, but anxiety, there's something called panic attack. And I know there are listeners out there whom would have had panic attacks. It's something serious. When you feel like you want to just die, you want to check out, you want to leave. Your heart is racing, you're sweating, and you're out of control. No control at all. Panic disorder comes from anxiety. That's ultimate. So these things, expressed to people all the time. And why I think it's important for us to address it is because 1 in 10 people with these disorders will commit suicide. So if you, a family member, would see changes and things like these in your friends or your family, and you do not act on it by trying to get them help, you can lose them. We'll have a caller. I want you to call in if you have any comments you want to make. And I know people, it's a stigma. That's the thing. Our society has created a stigma for people who would have had extremes. And this thing can happen to anyone. You could wake up suddenly one morning and hear a buzzing in your head. You can hear a song going on there. It wouldn't go away. You could start smelling something that is so funny, and it's not. What's wrong with the room? But you're smelling the stuff or have a abnormal taste in your mouth all the time. These things happen. What do? You wake up and all you hear is some noise. Ooh, ooh, ooh. Right throughout the day. Cross synapse of the neurons. That could be a sign that something is about to happen. Hallucinations and all these type of things, delusions. They start off very mild. And as I said before, the people who are affected by this stuff sometimes are the last ones to know that they have a problem. You go into, by the way, I had a tour of Black Rock yesterday. I had one of my nurses take me over there. It's not a good sight. People are sitting there and walking very straight. They're on medications, and there's no style to their walk, and very flat affect and all of those type of things. And it's serious. Any one of us can end up there because of life stressors and trauma. I want you to call me if you have any. We have half an hour. Plans might be to extend to a longer period of time, but for now, it's half an hour. 434-1771, 434-1790, and 434-1791. Call us if you have an experience. You have been diagnosed with depression or anxiety or any one of these mental problems, psychosis, bipolar disorder. Because remember, a lot of people can function with these things, We had presidents of certain countries in the world. I read them out to you last week, that would have had some of these type of illnesses, and they function as normal people. You can give us a call. And in a few minutes, we're gonna speak to someone on the line about some of her experiences with one or more of these disorders. But in the meantime, I will play Mariah Carey and Fantasy, and I'll be right back. And we got CC on the line, and we're gonna talk to her about her experience. Is she there? Good morning, CC.
Hello?
How are you, CC? How are you doing?
Fine, I'm fine.
Well, you know, I would like to talk to you. We have hundreds or thousands probably of people here in this country with some type of mental problem, whether it's depression, whether it's psychosis, whether it's anxiety, panic attacks. It doesn't matter. Some type of area where you want to be normal. Nobody wants to have these type of things, but it just happened. Tell us about your experience, please, CC.
Well, I didn't know.
Could you speak a little louder?
No, I said I didn't know I was depressed, anxious, nothing of the sort.
Okay.
But one Thursday night, the beating of my heart, the sound of my heart thumping in my chest woke me from sleeping. So I just sat up in the sitting position until morning, deciding I would go see the doctor.
Okay.
Well, by morning it had settled down, and of course I didn't go see the doctor. Friday night the same thing happened, and I said I'll go see him on Saturday morning. By Saturday morning I got up, I was feeling fine.
Okay.
At about 11 o'clock in the morning, I actually felt that my heart was coming out my chest.
Wow.
So I said to my daughter I wanted to go over to FMH, and I wanted my granddaughter to go with me. So off we went, and there I had a lot of tests done. My vitals were all normal. The ECG was normal, and they decided that they'll send me to see cardiologist. I asked when, and then the doctor said to me this morning, I said, cardiologist on Saturday morning? He said, yes, we've got a cardiologist here, Dr. Sparman. He's been with us recently, and I'll send you to see him. Well, I went over to see you, and you repeated the ECG again, history taken and all that. You repeated the history, ECG again, and it was normal. You said to me all the things that I wasn't supposed to use over the weekend that might cause any coffee or that kind of thing, you know, that would cause any more. You understand?
I understand.
Anyway, so the Monday morning I went in. I had an echo done. The echo was normal. Then
so you basically had a heart question. The heart exams were normal. When the first time the doctor told you had, what type of, let's say, problems he say you had really within, is it anxiety? Is it depression? What is it? What did the doctor say to you?
The SMH?
Yeah, I mean, did you see a psychiatrist?
No, not yet.
You didn't see a psychiatrist yet?
No, not yet.
All right, but tell me about it. How do you feel when this anxiety or this panic attack? Tell me, what was it like?
It's like, the best thing I can tell you is that you feel like you want to die. You can't move. You can't pray. You can't say anything. You are just rooted to the spot. In time and space, you can't do anything until it starts to wear off. It seems like an eternity after.
So in other words, you feel like if that's the end, that's how you feel?
Yes, that's the only way I can explain it.
So
I feel like I'm going to die when it comes on me.
Oh, it's interesting. So well, could you line up something in your life that could be the etiology or the cause of this type of feeling, or you can't?
Well, I couldn't, but it is only after I had the second ECG issue done, you said that was normal. Then you said to me, avoid the stimulants, come in on Monday and have the echo done, and then the treadmill, but I couldn't get on the treadmill because my legs are weak, and you gave me an IV drug, and you said that the echo is normal and the ECG is normal, and then we got into talking and the history taken and all of that. Then you said to me it was my back that had caused all this of me because I've got a very
but you know what? I don't mean to cut you because you got half an hour. Tell us, CC, what is it like to live with this thing where you have this feeling of impending doom, these panic attacks, these periods of depression? You have a little bit of that too, right?
Yes.
Tell us about that, the crying, those type of things. Explain to our listeners, what is it like?
It's like sometimes I've got to call maybe one or two places, and I all associate with the same thing, and just knowing that I have to call, I'll go off into a panic attack. Just prior to using the phone, or as soon as I finish using the phone, it just comes over me, and it's kind of like a sudden kind of something that I cannot avoid it, and I feel it coming. I want to get up and move that it would stop, but I just can't.
So it consumes your movement in your body.
Yes,
it takes
does.
over.
Yes, it does.
Oh, so
and then it's like the crying.
Yeah, the crying.
And then with each fall I cry a bit more.
Oh boy.
And then I get up and I go again and I cry again and I cry some more and I pray some more. But it's like it's a never-ending something, just going around a vicious circle.
So you're crying for no reason?
Well, I am crying. Well, I think it's no reason, but I know I'm crying because sometimes I just can't stand the pain.
Oh, the pain in your body.
The pain, I can't stand the pain. I can't stand on my legs. I can't go places by myself,
But then, but then wait a minute. When you go to make a phone call, why are you crying? Why are you crying before or after?
Because it's like what I'm going to hear.
Oh, what you going to say? You're crying because...
I know what I'm going to say, but I know, although it's useless calling, but I still get this urge. Well, call just one at a time and see what happens.
See.
So I do have to call to keep in touch.
To keep in touch. So this thing definitely interrupts your life, doesn't it?
It does, tremendously. Because sometimes I feel like I'll be like Alice in Wonderland.
Oh, wow. Oh, man. So do you feel sometimes that you're, like you got extra powers, or you feel like you don't have any control at all over your life?
No, more often than not, I feel like I don't want to do anything. I haven't got the will to do anything.
Oh, so in other words, would you say you ever had the feeling like you want to leave this world, and you don't want anything to do with it here? Or?
Well, sometimes I'm lying in bed, and the pain is really bad, and I'll get up and I'll walk outside, go out in the house, and then it follows me out there, and I'll say, well, are you out there? I'm coming out here because I'm tired of you in there. Why are you following me out here,
Wait a minute. Who's following you out there?
The pain.
The pain?
I'm in bed, and it hurts, and I go outside, thinking that it will leave it behind. Then to find it follows me around.
So, what do you say? You think it's like an object really following you, or what do you really feel? You feel it's within you, or outside just following you and inflicting this pain on you?
I feel like this pain is here with me. But if only since the pain would not leave, if I get up and walk away, maybe it will stay where it was, and not keep following me around so that it can have some peace.
Yeah, so it's really, I could imagine that your life in itself may be stagnated in this way. But you've gotten help, right?
Yes, I'm getting help for it.
And the medicines are helping, aren't they?
Yes, they have. Although I've had more increase over the time, but it's like, sometimes I wish I didn't have to take the medicine.
Yeah, no.
And I think that, when I look in the mirror, I feel like misery is looking back at me. But
the mirror, you feel like the mirror is looking back at you.
Misery. When I look at the mirror, I don't see my face looking back at me. I see misery.
Oh shucks, yeah. I mean, yeah.
So then I don't like to look in the mirror. But then I've told my psychiatrist, and I've said, well, this is how I feel inside, and that's why I will feel that way when I look in the mirror. But it's not how I look in any case.
Oh yeah, I know.
Understand?
Well, I am glad you're getting help, and I wish if we can talk to you again next week, I'll be happy to. This is interesting what you have to say. What would you have to say to those nice listeners outside who may be having the same type of problem?
Well, first, it doesn't seem like a problem, but when you realize that things are happening, that this is not me. Well, it's about time to get up and go and have something to say to some person, because you'll hear like you're crazy, she's crazy, don't mind her, but you know that you're not crazy, because you think you know why you're feeling this burden, this wanting to cry, and it's like, who wants to live in pain?
Yeah, I know.
Who wants to have somebody tailing around behind them everywhere you go, because you can't You can't go on your own.
Well, Cece, I thank you for calling. I know you had so many things to do today, and you took your time to call and encourage your listeners that if they're feeling this way, you're feeling that you're not in control of your body and so forth, and you're doing things that you normally shouldn't do or so forth. You should seek help. There are a lot of help here in Barbados, psychiatrists, psychologists, and all, and even your doctor can sit down and talk to you and help you. I want to thank you for calling, and maybe I'll talk to you about next week if you want to come and continue. I'm sure you have some other things you want to share with our listeners. Thank you so much for calling and talking to us, okay?
Have a good day.
Yeah. So I want to thank you guys for listening. Dr. Sparman, Dr. Sparman at the Sparman Clinic.com and www.thesparmanclinic.com. You can just check in there, and you missed this program because of what a busy schedule have been. You could just check in and update yourself. We tell you things to encourage you to live 30 years longer. Modification of lifestyle. Keep close to the plant, and I'll leave there to come back and see you next week. Don't forget, be on time, 9 to 9:30 every Saturday.